Hi everyone, I am Dr.Saritha Prem, Director of Amritha Surabhi Hospitals. So today with a new topic, that is menorrhagia. This is one of the conditions which many of our ladies used to suffer because it is one of the troublesome situation. So menorrhagia is a medical term which we use to indicate the excess bleeding during the menstrual cycle. So in each cycle they used to get more bleeding. So it's a condition where they can't do any activities or they will be too much disturbed to move their body due to this excess bleeding. So first of all, when you are concerned with this excess bleeding, so when you are going for some medicines, you must know what is the reason for this excess bleeding. So first and the foremost cause of this excess bleeding is hormonal imbalance. So as we all know, estrogen and progesterone is one of the main plays one of the important role in our menstrual cycle regulation. So when there is an imbalance in these hormones, definitely it leads to excess thickening of endometrium layer and it leads to more bleeding. So the next one is uterine fibroids. So fibroids, we know there will be bleeding and non-bleeding fibroids. So if there are any fibroids, it can lead to excess bleeding and severe abdominal cramps during the menstrual cycle. And the third reason is any thyroid dysfunction. It can also lead to excess bleeding and even sometimes irregular periods too. So it depends upon what category, whether it is hypo or hyperthyroidism. Like that. If it is hyper, there are chances of bleeding, excess bleeding. And also if there is any endometrial or cervical polyps, a small growth in the endometrium layer or in the cervix, so it can lead to more bleeding. And we all know the use of intrauterine devices. So as a side effect of this IUDs, it can lead to heavy bleedings during the periods. And any uterine cancers, pelvic inflammatory disease. So that is a condition where it can affect more areas of the uterus. And when there is adenomyosis, when the adenomyosis means a condition where the inner glands get embedded into the endometrium, and endometriosis is another condition. And if the excess use of contraceptives can lead to heavy bleeding during periods. So these all are certain conditions which are mainly a reason for the heavy bleeding. So when you are undergoing this condition, you must know what is the reason among these for your excess bleeding. And some will be having during this bleeding, certain symptoms will be there. That when there is heavy bleeding, not only the bleeding will be the symptom. So some ladies used to tell that there heavy clouds formation is there. That means even in within 1 and 2 hours, completely one pad gets soaked. So this is one of the typical symptoms, and they feel extremely tired, severe back pain, lower abdominal cramps. They feel difficult to do their activities due to the bleeding. That means even with a small movement, they get more bleeding. So these are some of the symptoms in this menorrhagia. And now we come towards the food what we have to follow during this periods. So we all know that when there is menstrual cycle, the digestive enzymes must be keenly measured. But that means we must take food which is very light to digest. Don't take any heavy food during this time. Try to drink water, hot water, that is in lukewarm form. And also try to have fruits more, especially hemotonic action fruits. That is you can have grapes, you can have berries, and you can have almonds and apple. All these fruits you can have this time. And night, if you feel discomfort to have heavy food like rice and all, you can have something which is very light and take more vegetables. Vegetable salads you can have at that time. So when the food is little light to digest, the cramps will be little less. This is one of the thing. And also we know some of the symptoms. One of the main symptoms which I missed to tell is anemia. There will be extreme tiredness due to excess bleeding. So the hemoglobin level may come down. So that time we have to balance our food with more heme stimulators, that is like leafy vegetables. You can have carrot, beetroot, such type of vegetables must be included in your diet at this time. And nextly, when we come on the treatment, especially on Ayurvedic treatments about this condition. So in Ayurveda we call it as Astrigdhara. So Astrigdhara is of many types. It is Vadacha, Pittacha, Kabacha and Sannipadacha. So depending upon each type, we used to advise the patient the medicines. So in Astrigdhara we used to give, first of all we will take the history and we used to find out what is the reason for this bleeding, and according to that only we used to give the treatment. So Rakta Stambhaka action, that is the hemostatic medicines will be advised here in order to control the bleeding. So in Ayurveda, one of the mainly used hemostatic medicines, as we all know, it is there are a lot of medicines, and one of the common medicinal preparations are Ashoka Arishtam, Kumari Asavam to reduce the pain and all, and also Pushyanika Churnam we used to advise in this condition, and Sunguvara Kashayam we used to advise, and Pradharandak tablet in order to control the bleeding. And if there is a fibroid or any other conditions which I told before, the treatment will be according to that side. So that medicines will be also given in order to control this heavy bleeding. So the main motto of Ayurveda is we used to tell Nidana Parivarjana, what are the causes we used to find, and then we used to advise the patient treatment according to that. Not only just to stop the bleeding, to completely to bring the conditions in a normal way. So finding out the reasons very important. So girls, you must not think that heavy bleeding is a common thing and don't take any just a hemostatic medicine and stop the treatment. You must find out what is the reason for this heavy bleeding during this period, and then you have to go for the treatment in a correct mode. In Ayurveda, there are very effective treatment for menorrhagia, that is excess bleeding during the menstrual cycle. So you can take the guidance of an Ayurvedic physician, and then you can follow the medicines and diet according to the advice. So some of the simple 2 tips which I can say during this periods, you can have just 1.5 tablespoon of Ashoka powder, that is we tell Terminalia combretaceae. That bark we have to powder it and take 1.5 tablespoon of powder plus 1 glass of water. You have to boil it and reduce to 1/4 and just add 1/4 of milk also. Then you can have this daily, twice daily. And the other one is you can take 1 spoon of coriander and 1 spoon of cinnamon powder. Just you can boil it and you can reduce to the half. That is in 1 glass you can boil and reduce to half and take at 1 time a day. So these are some of the simple tips which you can follow in an emergency situation. So just go through the points which I told and just find out the reason for this condition and just take the treatments properly. So just if you are seeing my channel for first time, just subscribe it and share to maximum, just to know, just to make everyone know the information about the diseases. I used to do the videos, and so share to maximum. And if you have any doubt, you can ask, you can post your comments in the inbox. Definitely I will reply you. So next time we'll see with a new video.